Hello, everyone. Welcome to our webinar. Thank you so much for joining us. We're really delighted to have you. My name is Melissa Withers. I'm the program director for the Association of Pacific Rim Universities Global Health Program. And this is the APRU Global Health webinar series that's organized by the APRU Global Health Program in conjunction with the University of Southern California Institute on Inequalities in Global Health. I'm going to be your moderator for the series. This is the first of 8 weekly webinars, so please join us for the next 7, same place, same time. Tonight we have the pleasure of hearing from Dr. Karen Greppen from the University of Hong Kong. The topic is, how have countries responded to COVID-19 and how can we learn from this experience? So I'm absolutely delighted to learn lessons about COVID-19 from Dr. Greppen. I just have a couple of housekeeping items for you. So please feel free to raise questions. There's a Q&A function there during the presentation. So I will be looking at the questions and be able to see them. Dr. Greppen is going to speak for about 30 minutes or so, and then we'll have time at the end for some questions. Next thing is, please share this webinar and social media, and you can tag at APRU 1997 on Facebook. Same with Twitter. The Association of Pacific Rim Universities is a nonprofit network of more than 50 leading universities in the region. Its secretariat is based in Hong Kong, and the Global Health Program is one of several programs, and it's housed at the University of Southern California. For more information about APRU, you can visit apru.org. And for more information about this webinar series and to see who's coming up in the next 7 weeks from now, you can visit apruplus.org. For information specifically about the Global Health Program or to join our listserv, if you're not on it already, you can go to apruglobalhealth.org, and we'll type those in there in the chat so that you'll have them. So responding, the synopsis of the talk is there on the website. So I welcome you to take a look at that. Dr. Karen Greppen's bio is also on there, so please read that. She's an associate professor at the School of Public Health at the University of Hong Kong. So I don't want to take up much more of our time. So please join me in welcoming Dr. Greppen. Thank you so much for speaking to us today.
Thanks, Melissa. Thank you for that introduction. So I'm just going to try to share my screen and I hope all of it works. Here we go. Can you see my slides okay? Wonderful. Well, thank you so much, everyone, for coming this morning, this evening, whatever time zone you are in. It's a wonderful pleasure to be here and to have an opportunity to talk to you. So the title of my talk is, How are countries responding to COVID-19 and what can we learn from this experience? And to be clear, I don't have the answers to all of the questions that we're going to ask. And in fact, what I would really like is to frame this as a broader research agenda that ideally people who are on this call, who are literally in countries around the world, might become interested in and want to take on a little bit, because I think there is some really interesting stuff here, and that would be great if others were interested in exploring some of this. So I'm going to start with this slide. I'm sure you've all seen this, right? This is the status of the global pandemic. It is addictive. I tell you, I sign into it almost every morning just to see how things are going. What's clear from this is that we are in a very new world. This is completely uncharted territories in terms of there being a global pandemic. This is the first real global pandemic of the millennium and of all of our lifetimes. There have been others in the past, but they really haven't had this this broad reach, this global reach, and to be honest, the broad economic and social effects that it's happening. And so you may be familiar with this, but you perhaps may be a little bit less familiar with the fact that what's also happening in the background to all this has been a massive policy response by just about every country on the planet. Most of this has been done in trying to mitigate the impact of the virus itself, and also in terms of trying to contain it and to control it within borders. But it's also to try to achieve other types of outcomes, in particular things that might be happening as a result of the big effect that's happening. So I just want to frame this by saying that at the same time, there's so much different variation and so much kind of interesting stuff that's happening across countries. So here is some data from a site called Our World in Data, which is a wonderful website which provides tons of information and tons of graphs, which I can't do on my own, in trying to capture cross-country variation and things. And they've recently added a section on policy responses. And so here's their data on contract tracing, which, arguably might be one of the least contentious kinds of approaches that, it is a recommended approach to try to contain the outbreak. And you can see even with this, there's huge variation across countries in terms of how countries are doing this and to what how intensely they're implementing this policy. We could also get into other types of policies. For example, these are quote unquote stay-at-home directives, which are what other people might be calling lockdowns. Here again, we see this huge variation in terms of countries that are doing this, and other countries that are not. And places where it is required by law to places where it's not happening at all. And so that's a puzzle. I think another really interesting aspect of this policy response that's happening across countries is just how rapid it has been. So here are the data for school closures as of February 1st. So this is, if you can recall back February 1st, seems like a lifetime ago. Really only China and Hong Kong and a few places around, immediately around China were in lockdown, had schools closed. Here's the data by March 1st. Not a lot of change, a couple of countries in Europe and the Middle East implementing. And here's the data by April 1st, where basically every country in the world had shut their schools down. And so in the span of a month, we went from almost no school closures to full school closures. And that's an interesting aspect. And it's not just public health stuff that's being effective. We're also seeing countries implementing all kinds of social and economic policies. For example, here are some data on income support, meaning countries are actually providing resources to people directly to try to mitigate some of the economic aspects. Again, big variation. And here's debt relief. So actually, waiving rent, making sure people can't get evicted from their apartments during this, waivers on utility bills all over the board. And again, huge variation across countries in terms of what's going on. So how can we explain all this? And so this is stuff I'm working on. This is stuff that I think, and if you ask me again in 2 years, I'll have a better answer to. But right now we're just getting started and trying to collect data to better understand some of these things. But I think it leads to some immediate questions. So when I started at the University of Hong Kong, which was only on January 1st, I didn't work on pandemics and nobody did. However, I had been, over the last 5 years, working on various Ebola outbreaks. So first starting in West Africa, and then most recently I have been working on 2 and now 3 outbreaks of Ebola in the Democratic Republic of Congo. And what my work has been looking at is really trying to understand the impact of government responses. And so we've learned a lot on the public health and clinical aspects of treating Ebola. We'd learned a lot on the sort of bigger governance questions in terms of how countries should work together. But my work has really been trying to understand just, what do governments do, national governments, and how does that have an effect? And I think based on that work on Ebola, but also looking at Zika and other major outbreaks of infectious diseases that we've seen over the last couple of years, there are a couple of consensus items that I think are important. So these are the lessons that we already had going into COVID that I think we could have probably would have concluded. So one, so just in terms of what we've learned from them is that population health impact can be much greater. So that sort of the adverse effect on population health can be much greater than sometimes the outbreak itself. Response measures, so we must distinguish between what the outbreak itself does and what we as a global community do to respond to the outbreak, can actually have a lot of unintended consequences. And in particular, many of them have very important distributional consequences. And then global cooperation, which is basically how countries work together, is also very critical in terms of thinking through how to affect an effective outbreak response. So what do we know from previous outbreaks, for example, Ebola and others? We know that health systems matter a lot. And in fact, when we have these outbreaks, there's a lot of stuff that happens within health systems that can greatly undermine them. So in West Africa, when there was outbreaks of Ebola, health systems themselves were in some places completely decimated. A lot of this driven by what happened to health workers. So many of them got sick, many of them died. Others left because they were afraid of getting sick or contracting the virus. And also, in many places, we saw governments basically shutting down of non-essential health services. As a result of that, we know that there was at least an 18% decline in total utilization of health services across the board. Some aspects more affected, but more than others: maternal and child health, HIV, TB services, all greatly affected. As a result of that, we know that there are likely to be huge population health impacts. And possibly those were greater. Many more people would have died of some of those other things than they would have from Ebola itself. And you might just say, well, that's just an issue that happens in low-income countries when there are these outbreaks. But the reality is no, as we've seen this also when, for example, SARS was in Taiwan and Canada back in 2003, we saw that people didn't present to health clinics anymore. People were afraid to go in, or some services were canceled. And again, we saw big drops in utilization of health services in that context. As I mentioned before, that we also know that there are huge differential effects of outbreak response. One of the big ones is related to gender. So we've seen this time and time again in many different outbreaks. For example, we know that most health workers are women. 70% of all health workers globally are women. 80% of nurses are female. And so this really puts them at greater risk of exposure given their frontline role in outbreak response. In West Africa, a year after the first outbreak, obviously many people had lost their jobs. We know that there were some people who recovered from this job loss more than others, and it seems that men were able to recover much quicker from the job loss than women. School closures, I mentioned basically every country in the world now has shut down schools. That can have obviously very important short run effects. What's less obvious is that there's also these longer run effects that could happen. So for example, when there was a big outbreak of measles in Niger a couple of years ago, we know that girls were much less likely to go back into school. Once they're out, it's hard to get them necessarily to go back into school. And in Sierra Leone, very well documented that when girls were out of school, in particular teenage girls, it led to higher rates of teenage pregnancies, and that led to subsequently lower re-enrollment rates of girls back into high schools after the outbreak had subsided. And again, other things that we know that happen, especially when people are forced into difficult situations or there's economic stressors, we see increases in gender-based violence, and this has been observed and documented in many previous outbreaks. Just gonna check the chat box here, sorry. Okay. Global coordination, very critical for ensuring that that we are working together as a global community and ensuring that we are doing the right things to help each other out, even in the context of what we're going through right now. Believe it or not, there is actually a very explicit legal document, a framework that all countries in the world are now a party to, known as the International Health Regulations, which was specifically designed to help keep us together in the context of outbreaks and pandemics. They were designed to prevent, protect against, control, and provide a public health response to the international spread of disease in ways that are commensurate with the risk. And this is a very critical aspect of these global governance arrangements, to avoid unnecessary interference with trade and travel. So this framework has sort of a dual purpose. It's one, it's to sort of provide the public health aspects of response to outbreaks. But it also provides very clear guidance in terms of how countries should be responding with regards to trade and travel restrictions. In previous outbreaks, we have first seen upwards of 25% of countries implementing some form of trade and travel restriction. This is true in both the West African Ebola outbreak, but also H1N1 a couple years earlier. However, we didn't see any travel restrictions imposed in the context of the more recent outbreaks of Ebola and DRC. Some people thinking that we had all sort of agreed to play by these rules in a much more coordinated fashion. And part of this is driven by a lot of kind of consensus building that sort of suggests that they don't do all that much in terms of trying to prevent the spread of virus. And so but they can be hugely disruptive to outbreak response. So the question is, how are we doing? So I've mentioned earlier how countries are doing, but to what extent do we see any of the lessons from previous outbreaks being integrated into how we're responding to the current COVID pandemic? Overall, I think we're doing a very terrible job. So there's huge evidence accumulating in all kinds of global contexts that routine health services have been greatly disrupted. Here is some data just from yesterday's New York Times, in which they present data on national data on emergency room visits in hospitals across the United States for March and April. And you can see there is a dramatic decline, really a 50% decline in total use of emergency room visits in these places. Obviously, some of this is being driven by demand side factors. People are just putting off things that they wouldn't do otherwise. But some of it is also being driven by policies that are being put in place to say that some services are essential, others are not. So for example, we've seen some services being put on hold, and all of this is going to have huge population level health impacts. In particular, some services are probably much more likely to be disrupted by this than others. And for example, we've seen many countries deeming things like sexual and reproductive health services, like abortions, as being non-essential. Where these have legal right to be delivered, timing matters an awful lot, and so there's quite a lot of concern that if we put these off, then we won't be able to. They won't be useful to these women. We've also seen huge spikes in reported rates of domestic violence happening in all countries in the world, whether it be high-income countries like France and Belgium, Italy, to low-income countries also, or middle-income countries. And we've seen this documented in so many places. Huge, 50%, 30% increases in these in many countries around the world. How are we doing with regards to complying with the international health regulations? Well, even according to the WHO's own data, as of early April, every single country in the world had implemented some form of a cross-border travel-related measure. Many of them are in direct violation of the international health regulations. Some are compliant, some are not. And we're starting to see this having an effect, in particular in places in the world where it's more challenging to access, for example, in sub-Saharan Africa, where we're seeing it becoming a barrier to the response itself. So overall, I think we haven't spent a lot of time thinking about how we should integrate some of the lessons from the past into the current outbreak. So then that leads us to this question of, here we are today, as all the countries in the world, we're responding. Is it possible for us to be able to say, are some countries doing better than others? I think this is a very interesting research question. I also think it's a very complicated research question, and I'll walk you through why I think some of those reasons are in a few slides. I think it's easier for us to get a sense of who's not doing a good job, right? So this is, I chose a particularly sad-looking picture of Dr. Anders Tegnell, who is the epidemiologist in Sweden, who was largely responsible for developing the strategy in Sweden on how to respond to COVID. And just 2 days ago, he even admitted on a radio show that, maybe today with the knowledge that he had today, that perhaps he would have responded differently, that perhaps the strategy they adopted was not the right one. And so while it's easy enough to say, you know, maybe this country didn't do a great job, and by the way, I'm not totally convinced, because in fact many of the aspects of the Swedish response look very similar to what happened here in Hong Kong. We don't know who is doing a good job and who's not doing a good job. And so what I would like you to do at this point is, if you are on your computer or if you have your phone handy, could you just do the following? Go to the website that's given there. It's very simple, www.menti.com. It will ask you to enter 6-digit code. Please do so. And please just answer the 2 sets of questions. And okay. So I'll give it a couple of minutes. We have 8 responses so far. So please just take a minute or two again. So go to www.menti.com and answer a few questions. Okay, so we have responses from about 25, 20, 30 responses here. So I'll just let it go for a little bit longer. So I asked some pretty simple questions. You know, how well do you think your government is doing with regards to responding to COVID-19? I would say a pretty mixed response in terms of how people think their country is doing. We don't see an overwhelming high level of positive response towards how your country is doing. Arguably, public health might be the dimension that countries have seem to be doing slightly better on than others. And that some of the other aspects, like the economic outcomes or the social outcomes, are perhaps not being dealt with as well. But overall, you know, we're giving our countries sort of a 3.3 out of 5, meaning we're not doing a great job. It's clear that we're not responding as well as we could be. So the next question I had for you is, what factors might explain why some countries do better than others? And I'll just give you a few minutes. The slide should refresh now to ask you for a new set of questions. If you could just take a few minutes to answer some of those questions, we'll see what comes up. Could people see this one? I'm not sure. It's not getting any responses, which makes me worried. Oh, here we go. Luck, I like that one. Ooh, luck is coming up again. I shouldn't have said anything. Great, so thanks for those wonderful answers. We're starting to see a bit of a consensus. Leadership seems to be the #1 reason why people say that some countries might be doing better than others. Discipline. #2, the behavior of people, culture, their ability to also think through that. At one point we saw preparedness and coordination being up high on the list, but where it's going down a little bit, it looks like. Luck, obviously there. So clear, there's not going to be a simple explanation here too, right? There's a lot of things that probably led into this. So if we're trying to answer this question about why are some countries doing so much better than others, I think it's going to be a really challenging research agenda. So first off, in terms of how we would think about trying to answer a question of this nature, I think it's really important to have a clear consensus in terms of what we think these outbreak responses are meant to do. Meaning, what are the outcomes that we should be caring about? Clearly, the public health outcomes are a big part of this, right? So this could include measures of why, how many people were infected, how many cases there were, how many people died. But even a broader question about over what time frame. Part of the rationale for the response that happened in Sweden was a rationale that in the longer run, more people would be able to return to their lives more quickly. And so there isn't even a clear agreement in terms of what we're trying to achieve on the public health outcome. I think it's also clear that we shouldn't be just focused in on COVID as the thing that we're most concerned about. Total population health is probably also as important, if not more important, in terms of better understanding how people are interacting. We've seen huge declines in use of health services where we've measured it. How is that going to contribute to excess mortality in the coming years, and what do we need to do to think about that? Economic effects are clear. There's been a huge shock to the global economy. There's been a huge shock to every national economy. There are millions of people at work that weren't out of work even just a couple of months ago. There is no international travel. There is no international trade and tourism. And global trade has also been greatly reduced. And so this is going to have massive financial consequences and economic consequences for the global economy for years to come. The recovery from SARS in places like Hong Kong took years, and this is going to be much more extreme than that. Social capital is also being greatly affected. It is around the world right now, there is so much level of social unrest. What we're seeing in the United States, what we're seeing here in Hong Kong, we're seeing all over the planet. There is a rise of people feeling that their governments are not doing the things that they want them to do, and an action to do something about that. So is that a consequence of the global response to COVID that we should care about? I've mentioned there are potential gendered effects, and there are other distributional effects as well. For example, how is it disproportionately affecting the poor versus the rich? These are things that we should consider as well. And also political outcomes. We're going to see a number of elections in the coming years, and people will not forget the way in which governments responded to this outbreak, and that could also be an outcome that we care about. So here are all the potential things. There's probably more that we think that we should care about, but how should we weight these? To what extent is this just about public health or about a broader kind of social response? So I asked you why some countries are doing better than others. You've come up with some of the things that I think also are part of it. Preparedness. So there are, as part of the international health regulations, there are a number of frameworks that were helped to make countries prepared for outbreak and pandemic response. There have been many efforts to collect data on this, score countries on this. And it seems to be the case that the countries that were quote unquote best prepared on paper are not necessarily the ones that are doing the best at this point. Or it doesn't seem to be explaining the whole situation. So it's probably part of the story, but it probably can't explain all of it. So we, especially as public health researchers, would better understand what is it about the way in which some countries prepared and others didn't that made a difference. Health systems themselves probably played a bit of a role. So, in countries where they have a more nationalized type health system, publicly financed, publicly run, versus countries on the other end of the spectrum where things are more privately financed and privately delivered, there's probably been some differences in terms of how countries are able to respond. Regime type is also probably part of this. I mean, basically, to what extent were countries democratic, or what extent countries are autocratic. Typically, in the context of public health, we like to think that countries that are more democratic tend to do better. I'm just going to share with you some data from a working paper by the authors who are listed at the bottom. Here, they looked at different forms of regime type in countries around the world through the first 100 days of COVID-19 outbreaks, the first 3 months, and tried to see how countries did in terms of both the total number of cases, but also in terms of the timing of cases. And here they actually show, and I won't get into the details, but basically higher is worse and lower is better. Democratic countries seem to have had more cases on a per capita basis and had them earlier. And so if we take those to be valid measures of outcomes, it may be the case that democratic countries are actually doing a worse job here than non-democracies in terms of response. And that goes against our sort of thinking about what's important and how health systems should be working. But if it in fact is the case, what are the ways that we should learn from that lesson and to think through? State capacity, this is just really in terms of how strong governments are in terms of being able to respond. Unclear to what extent that has been effective. Okay, you only see the Menti website. I'm gonna, oops, I've been kicked out. Can you see my slides? Can you see my slides now? Okay, perfect. So let me just bring back up that slide that I was showing earlier. This is data in terms of how countries are doing versus democratic versus autocratic nature. More democratic countries are actually doing worse in terms of higher number of cases and also getting them sooner. State capacity, another important thing, just in terms of how, for example, to what extent a country is devolved and down to lower levels of administration or a much more centralized country. Again, this might be going against some of our beliefs in terms of what's important, but we haven't done the full postmortem to better understand this, but it's something that's worth understanding. People mentioned human behavior. I think this is also a really important thing, but also the way in which people believe in the government, or the way in which people trust their government to make the right decisions. We've definitely seen lots of examples in which countries people have sort of gone against the directives in which their governments have shared with them. And then leadership, which is the number one thing that people had answered as well, is clear. Who is in charge at the time of this, and to what extent they adopted a quick response, to what extent they had conversations with the scientific experts, and to what extent they even brought in other types of values and issues to try to deny the existence or the importance of this. All of these things clearly have made a difference in terms of why some countries are doing better than others. So I think this broad question is really important. I mentioned earlier all these lessons that we had from previous outbreaks and how we did a poor job of integrating them into the current COVID response. We need to think now in terms of what are the lessons that we have learned so far from the COVID response that we want to be able to integrate into what we're doing now. But there will be more outbreaks, and we need to think through how that will work. We need to be able to develop some better planning, better guidance to think through what are the right policies. We've had this huge proliferation of policy responses. If we could all agree of what the right outcomes are to be evaluating, I don't think we could even come to a clear consensus in terms of which countries did the best, right? It's just an incredibly complex thing to try to answer. There's been a huge range of policies that have been implemented, many at the same time. The effect of a policy in one country can have an effect on another country. It's also possible that people's human behavior changes much more than even their government's policy changes could account for. For example, in the United States, according to data by OpenTable, people stopped going to restaurants long before there was an actual directive by government to do so. And so it's going to be really challenging to do it. But I think it's important. I think it's really important that we as public health researchers take the time to step up and to try to think through what we should be learning from this, and how we can use this to both inform the ongoing response, but also to think through how we'd want to respond again in the future. So, there's been this kind of huge proliferation of policies, clear that the sort of urgency has superseded any kind of ability to think through logically what are the right things to do and what we should be doing. But part of that is there really hasn't been enough guidance from the public health research community to really say that this is what we should be doing. This is how you modulate your thing. And so there's a need to help fill that gap. And so what can we do as researchers? We're all located in different countries around the world. We should be, at least at this stage, all collecting data, right? We should also be trying to understand what happened in our countries. In previous outbreaks, it was always localized. And so there was always, a big number of people who could contribute to our knowledge generation in that thing. We all are affected by this. And so it's up to us to sort of tell our own country story in terms of how things evolved and what happened and when. So you need to be collecting broad range of data, not just about public health, but broader aspects of the response and the outbreak. We need longitudinal data, right? We need to be thinking of, oh, this is going to be happening over time. Things are going to change. We need to be collecting data in such a way that's standardized. So if we want to make comparisons across countries, we can do that. But it's also important that we get these disaggregated data. We've talked about distributional challenges about men versus women, poor versus rich. If we don't have the data on that, we won't be able to make that case that this is an important consequence of the way in which we respond. So I'm going to stop there. I hope I've piqued your interest in terms of trying to take this on as a research question. Raised questions, haven't necessarily answered them, but I think there's a clear sense that the research that public health that happens in public health universities is important and will be important both for this outbreak but for future outbreaks as well. So thank you.
Okay, fantastic, really interesting talk, so much to think about. And I neglected to mention that Dr. Greppen has a PhD in health policy and an SM in health policy and management from Harvard and School of Public Health. So she's the perfect person to talk to us about these issues. She's also recruiting students with interest in conducting research around health policy issues globally. And so please look at our website. She's also posted some additional readings, recommended readings. So thank you again for that talk. We do have some questions for you. And I would like to take this opportunity to ask my first question, which is that you mentioned, you recommended that the research community, that we need to do more in terms of providing scientific evidence and collecting data in order to inform our government. What happens if you have a government like mine, for example, or other governments that don't appreciate the scientific recommendations, or maybe even believe that this is a real thing? What can we do in the cases of these types of governments?
So maybe I'll start by doing what so I'm Canadian, what my Prime Minister did this week, which is just take a very long pause to think through that question. I'm joking. I think it is exactly in this situation where there's even more impetus for public health researchers to, in real time, be providing the data and evidence to try to make the convincing case. We've seen examples from some countries, and I'm not going to say it's possible in all, there are some exceptions clearly, where evidence in real time has made governments change their policy approaches already, right? So in the United Kingdom, following the report of the Imperial College reports, or suggesting that these things make a difference, actually did shift their policies to some extent. We've seen this in other places too. Here in Hong Kong, the scientific community, the public health community has a very close working relationship with the government and is in constant contact and sort of helping to inform that. So I'm not saying that every country is looking for that advice, but I think it's even more critical in places where we're seeing responses that may not be reflective of what we're learning from this outbreak, to make sure that information is available and getting out. And so having opportunities to share your findings in whatever fora makes sense is very critical, and more so in those places than in others.
Okay, thank you so much. Next question comes from Holly at Sydney. Given the history of pandemics faced already, why does this pandemic seem so novel and new? And is there not an established way of responding?
Yeah, I mean, that's a great question. It is exceptional in terms of how much attention it has garnered, how responsive the governments have been. it's arguably not the most, most severe pandemic we've ever faced, at least for the time being. The 1918 influenza outbreak, pandemic was clearly a much more severe pandemic. There have been others that have happened in the interim that have killed more people. Again, so far, we're still in the middle of this, so it's very hard to know what this will turn out to be. But a lot of things have changed in that time period, right? So, back in 1918, a travel restriction usually meant that boats couldn't sail anymore, right? Boats couldn't harbor in these places. And today we have flights to every corner in the world. I can effectively fly to almost every continent in the world from here in Hong Kong. And so, the real guidance, those kind of directives in terms of, how these things happen really hasn't been fleshed out. I'm doing a lot of work right now in the context of understanding the impact of travel restrictions. So what evidence, I mentioned earlier that there was this consensus that travel restrictions don't work, but where have they really been tested to show that, right? So, a lot of the evidence is drawn from Ebola outbreaks in parts of sub-Saharan Africa, which clearly, the travel implications of having a travel restriction there are very different than imposing them on a country like China early on, or the situation that we have today, in which basically international travel has come to a complete halt. And so, no, I don't think we have the evidence that we really needed. This question about lockdowns, early on in the outbreak, when parts of Wuhan were put under lockdown, initially a lot of countries said, oh, that's crazy, we would never do that. 2 months later, 2/3 of the countries in the world were doing some form of lockdown. So we don't know, and we have really been updating. We've had more data being generated in real time from this outbreak. And so I think the directives that we have can be improved upon, and the evidence that will come out of this outbreak will really be the stuff that will inform that going forward.
Okay, thank you. So we have two very similar questions from Grace in the Philippines and Ian in Hong Kong, which basically is, what are your recommendations for either students or faculty? What research topics do you think are most important in this type of public health research?
Yeah. I think it's one of these things where, you should do what you are good at and what you know. There's been a lot of research on the epidemiological aspects of the outbreak. That's obviously very critical work. I do have concerns that some of the other aspects are perhaps not being as fully researched, at least not in the same sort of real-time aspects. So what's happening to certain populations? How is this affecting social outcomes? How is this affecting economic outcomes? So depending on what it is that you do, I would recommend taking the strength of what you have and bringing it to this problem to see where you could have the most impact. We shouldn't all suddenly become epidemiologists, right? That is in fact part of the problem, that we all sort of have suddenly become these armchair epidemiologists. But what is it that you know something about? And my guess, whatever it is that you were working on before, has been affected by this. And so documenting that, understanding that, having a view of what can be different in your own particular field is what you should be doing.
Okay, thank you. So next question comes from Angus in Sydney. It seems to me that an important factor was political ideology of the state, dominant cultural values, how libertarian governments are, etc. Some governments were slow, whereas some governments were quick to act. Just a week or so made a big difference. What do you think the place of political cultural values is in the response?
Yeah, I think this is huge. I have less of an opinion, because it's not my area that I study a lot of cultural values, although I suspect there are some important differences that we'll need to understand. I think in particular around some of the public health measures in terms of how people tend to interact are probably played an important role. But on the political dimensions, for sure, I think political ideology here has been a very important part of this, not just in terms of, what kind of policies, but even around some of the way in which different governments were, receptive to public health advice, the way in which they were receptive to scientific evidence. All of this was probably played into, some of the aspects by which countries were quick to respond or not respond. I think it probably played less of a role in terms of, how countries responded, because I think ultimately, a lot of countries did whatever everyone else was doing at some point. But I also think that it's an ongoing discussion. And, for example, we're starting to see people using, politicians in different countries using the outbreak and the outbreak response as a way of continuing to manipulate sort of political outcomes. And, for example, of suppressing protests in parts of the world, or of continuing to keep some people under lockdown. And so the context between politics and the responses is important, is very critical. And I think that's going to be a big part of the explanation. But I also think it will challenge some of our preconceived ideas of how important politics and how things like democracy play into this. I think we'll be updating our views in terms of what's important as a result of this.
Okay, great. And so we actually have three very similar questions. And basically they are around Mohammed, for example, and they're around why you think the low income countries have reported cases that are quite low, and then building off of that, what suggestions would you have for these low resource settings in terms of managing the pandemic in their own countries?
That's a great question. And in fact, most of the work that I'm doing right now in the context of this is mostly in low-income countries. I've continuing to do work in the Democratic Republic of Congo right now, which is a really interesting case because they've taken their Ebola kind of apparatus and turned it into a COVID response team. So I think there's a lot of things going on. I'm not an epidemiologist, so I won't comment in terms of whether there's something different about the way in which the outbreaks are evolving there specifically. I do think there is some concerns about there is less testing happening in these places. So in that sense, maybe the true numbers are much higher in these places, and so we have a higher rate of unreported cases in some of these places. I think that's part of it. The other thing that I think is worth mentioning, and I think is something that is worth also exploring, because lower income countries have been dealing with different disease burdens for a longer time period, in many ways they're actually much better prepared to think through some of the public health aspects of the response. So for example, countries that have had, implementing DOTS programs, they know how to do contract tracing, they know how to do community mobilization, they know how to do all these things. I think also in places in sub-Saharan Africa where there's, strong networks of community health workers, the capacity to do these things. Also, I think a more willingness on behalf of the citizens to understand the importance of changing behavior in the context of public health threats. I actually think that many low-income countries will end up doing a lot better in some dimensions than richer countries, because of the fact that their public health systems are public health systems, and that they might be better equipped to respond.
Sorry, I was muted. Okay, next one, another similar question comes from Stefano and Iris, which is basically around, do you agree that travel restrictions are the best way to prevent the spread of the pandemic?
So that's a really great question. I would say at this point, it is too late to prevent the spread of the pandemic. I think there are a couple countries who claim that they don't have any cases, and I don't actually believe many of them. There are some island countries where maybe they don't have any cases yet, and maybe for those places, then perhaps if they continue to keep their borders closed, they will prevent the spread. But the reality is spread has happened, and despite the adoption of travel restrictions. And so there's a big question of what if we had implemented what we had today earlier in February, would the outcomes look different? And I think they would look different. So they could have played a role. But I think the more interesting question that we have right now is, what is the role of travel restrictions in continuing on? So I live in Hong Kong. We have effectively contained the outbreak here in Hong Kong. We've had a very low number of cases. Our border is essentially open. However, if you come in, there are additional health measures that are required of you. For example, you must go into 14 days of quarantine, and it can be done at home or in a government institution, depending on where you're coming from. And as a result of that, we've had effectively no local transmission now for a couple of months. Our schools are open again. Life is effectively going back to normal with some caveats, clearly. So I think a more interesting question right now is what is the role of travel restrictions in helping countries that have effectively contained their outbreak to continue to help contain their outbreak? And I think we don't have answers to questions like that, because all of the existing literature has really looked at the sort of early stages of containing an initial outbreak, and really haven't looked beyond that in terms of how they can be used in other phases of the outbreak.
Okay, sorry about that. Next question comes from Young Sik Ok from Korea. The coronavirus has led to an abrupt collapse of waste management chains. Safely managing medical and domestic waste is crucial to successfully containing the disease. Do you have any suggestions on policy to manage medical waste management?
So I don't. This is, I think, a good example of, I don't know much about medical waste management. I could imagine that everything has been disrupted. I mean, we know, there's been huge disruptions in trade of commodities related to outbreak, the commodities required for response, PPE, these types of things. It's likely having an impact in other sectors as well. But this is a perfect example of people who know something about this topic should be helping us answer that question. It's clear that every country is likely being affected by this. So what is the right approach to this? And whether that means you need to link up with someone who has more of a policy perspective in terms of helping answer those questions, then that's what you should do. But it should be the people who know things about this topic that really should be driving the charge on this. And there's going to be huge demand for the answers to those questions from every country around the world.
Thank you. Next question comes from Erlinda, who is on our advisory board. And she asks, in your opinion, how much of the concepts or principles of primary health care have been utilized or integrated into the strategies to respond to COVID-19?
I think this is a question that does vary by international context. I think some countries have used primary healthcare in more effective ways than others. I haven't seen anyone write this up, and so I'd be curious to know if others have thought this through. But I think, some of this, what I was talking about earlier in terms of whether it be primary healthcare or sort of more community level driven responses to components of our health systems, they clearly, where we're going to need them to do public health responses related to contract tracing, getting people in for the services that they would otherwise be foregoing because of the outbreak. These are critical components. I think countries that have had stronger public health, primary health care systems, and those who've thought about them as it being important components to their response are likely using them in better ways. But I'd love to see that better written up, and it's a perfect opportunity to make the case for bigger investments into primary health care.
Thank you. Emma from the US asked, from a policy perspective, How useful are national averages for comparing countries, and how well has each responded, given that some of the highest burden countries have semi-autonomous states with divergent policies within?
Mm-hmm. Yeah, I mean, so this comes to some of the questions I was talking about earlier in terms of, even thinking about state capacity and how countries are organized and so on. The reality is, especially in big countries like the United States, each state is its own outbreak, right? And so in that sense, I think in places like that where there are literally, dozens, if not more, sort of localized outbreaks happening, a national average is not the most useful thing. Because it doesn't really give us a sense of where each of these outbreaks are at any given time. I think national averages are useful for certain purposes. I think they also need to be taken with a huge grain of salt. We as researchers can improve upon them even by, for example, pushing for better disaggregation of the data along different socioeconomic lines, whether it be gender, whether it be age. We should also be pushing for more use of kind of standardized measures, so internationally standardized measures around age and so on, especially amongst the media. I think this is a concept that the media doesn't fully understand, that it actually makes a difference if, some countries have a huge elderly population and some do not. And so that's up to us to sort of help inform them that these things are important. So averages give us one signal, it's not the best signal. Again, we as public health researchers really need to help inform the general population about why it's important to not just look at the average.
Okay, I think we have time for this last question. Actually, it comes from two people, Ava and Sherwin, and they're basically talking about it. The pandemic made the whole world realize how important healthcare providers are. And what do you think? Do you think there should be new policies around, for example, increased compensation to prevent nurses or from resigning, or kind of to retain healthcare workers?
Yeah, some of the saddest pictures that I burn, holes in my head in terms of my thoughts and what I'll take away from this outbreak, from this pandemic, are, pictures of nurses in New York City wearing garbage bags, right? To protect themselves against the potential spread of the outbreak because they simply didn't have the commodities. Health workers are the critical aspect. They're the front line, they're a backbone of our health systems. And it's sad that it has taken another pandemic to sort of emphasize that this is so critically important. It's clear that we need them. It's clear that they are essentially what will get us through this. So yes, I do believe this is important. This is where analyzing some of these, for example, economic policies is really important. So there are a lot of places where people were being paid extra to stay home because of the pandemic, whereas health workers weren't getting paid anything extra to keep doing the job that they were doing before. And their job now was much more difficult. So are there countries out there experimenting with sort of hazard pay with health workers? And what did that do? Could we understand from a public health perspective and a research angle, did it make a difference? And to understand whether or not that's important or not. And I suspect the answer might be yes.
Okay. Well, thank you from, I think, around the world. Thank you so much to Dr. Greppen, who is Associate Professor at the School of Public Health at the University of Hong Kong, for sharing your wisdom about policy. There's, I think, a lot still needs to be done. And I just wanted to remind you again that the webinar was organized by the APRU Global Health Program and USC Institute on Inequalities in Global Health. Please help us to promote these and future webinars by going to apruplus.org. The slides and recording will be shared via an email to everyone, and they'll be available on our website, apruplus.org. Next week, I invite you to register now for our next webinar, same place, same time. Angus Dawson from the University of Sydney will be speaking about bioethics and COVID-19. And I assure you that's going to be a really interesting talk. So I just want to say thank you to everyone for joining. We hope that you've enjoyed it and look forward to seeing you again next week.